discussion today, our regularly planned, is the new Republican Study Committee proposals. I've got 100 pages of all kinds of different things on all kinds of fiscal policy, but we're just going to focus on Social Security. Not going to talk about Medicare or anything else. We're just going to focus on the few pages that talk about Social Security today. So if you have any comments, suggestions, opinions, anything like that, make sure you put them in the comments, and let's keep our discussion / debate respectful. So no personal attacks or anything like that. We're trying to solve a very important problem, so we need sanity. All right, and then after we discuss, after we solve the Social Security problems, and once we put Social Security back onto a strong footing, because we'll solve the whole problem today amongst ourselves, right? And it'll be easy. We'll fix everything. Once we finish fixing Social Security, then we'll get into our regular question and answer period, and we'll talk about all things Social Security, and I'll answer all your questions. So that will be after we have our little discussion on the Republican proposals on Social Security. All right, so get your questions ready for that too, but also type in your opinions on the proposals that we're going to go over. All right, okay, and as always, make sure you like and share and all that kind of stuff. We need your help. We need to get this information out to more people, so please share it on Facebook and Twitter and Instagram, and contact your local news, and share the channel and everything like that. We need more people to get accurate information. There's just too much clickbait out there. There's too many social media personalities giving out incomplete, incorrect, misleading information. So we need to get the actual information out there. Okay. All right. So if you're new to my channel, my name is Ed Weir. I'm a retired district manager of the Social Security Administration. I've helped millions of people out throughout the country get everything they're entitled to from Social Security, Medicare, Medicaid, all that kind of good stuff. So my thing is at the bottom there. All right. So let's go ahead and throw it up here. And this is the report. Like I said, it's about 100 pages, but we're only going to focus on a few. Fiscal Sanity to Save America. And this is the chapter from the Republican Study Committee on Social Security itself. Like I said, it's probably about 8 pages or so. I'm going to try to stay neutral here. I'm not going to be liberal, conservative, Republican, Democrat, Whig party, whatever. But come on, the chapter cover page is this: preventing Biden's cuts to Social Security. So, which is implying that before Biden, Social Security was good. So this whole Social Security issue is a brand new issue, and we've never had problems with Social Security. And 4 or 5 years ago, Social Security was perfect, and it was going to be solvent for the next 100 years. But all of a sudden, Biden became president, and now there's going to be cuts. That's just kind of an unfair. I was just talking about clickbait, and I think that's clickbait-ish. All right, so put that to the side. So that's kind of framing it. Yeah, it's kind of not a good. Okay, so I read through this whole thing, and frankly, there's not a lot there. So the 8 pages talks about the problem we're going to have. Spending in Social Security and healthcare nearly doubled. Okay, so they kind of throw healthcare in there, and so it gives kind of skewed numbers. Okay, we're talking about Social Security, and why did you throw healthcare in there? Healthcare, yes, healthcare is going to be a big issue, but if you're going to talk about Social Security, use Social Security numbers. So I was in high school. I had no life. I was the captain of the debate team. So I used to go to Baylor University in Texas during the summer to debate camp. Yes, I was a geek. Anyway, so there's that. And then I joined the Marine Corps. So I went from being a geek to Marine Corps sergeant. So what are you going to do? All right. So it says if you step away from the Democrats' political rhetoric on the Social Security retirement program, political rhetoric, okay, I think both sides use that. The problem is simple. I agree. The problem is simple. Retirement benefits as they are currently structured cost more than the revenue streams that pay for them. Ignoring this fact, as the Biden administration and congressional Democrats have, will lead to the largest across the board cuts to current Social Security retirement benefits. I don't think Biden, or I don't think anybody has kind of ignored it. They haven't done anything, but they certainly have ignored it. And one of the things that the trust fund, Social Security was originally designed as kind of a pay as you go. So the current people that pay into Social Security pay for those that are that are currently receiving benefits. Okay, so it's kind of a pay as you go. They changed it within a few years. It was in, I think, 1938, where they said, okay, for particular situations, like maybe the baby boomers. That came afterwards, obviously, 1945 to 1946 to 1964. This baby boomers, 76 million Americans. But in the 1980s, they said, okay, the baby boomers are coming. We're going to need a trust fund. Eventually these baby boomers are going to have this big mushroom, and so the current beneficiaries, if they have a whole bunch of kids, then that's fine. But so that's why the trust fund was built up in preparation for the baby boomers. This year is I was looking at the Department of Census, and this year is the largest year in U.S. history for people turning 65. So this is the big year, the big peak. Congress knew that in the 1980s, so they said we need to build up the trust fund specifically for this. So that's where that money was for, is for the baby boomers coming up. And that was planned. And yes, it's going to be spent down, of course. That's not an issue. It is, but that was kind of planned for. The issue going forward is obviously the pay-as-you-go part of it, right? So if we just do current people paying to the system, then it's they're going to be cuts, 20 to the 30% cuts. So that's what needs to be addressed. Okay, so like I said, I just cut parts of this. And they, according to the report, one of the biggest things is the faster than anticipated depletion of the OASI. The OASI is the Old Age and Survivors Insurance. Yes, Social Security is insurance. SSDI, Social Security Disability Insurance. OASI, RSI, Retired Survivors Insurance. Medicare, look at your Medicare card. Medicare health insurance is all insurance. But that's why one of the things I do is I put people in touch with people that can also get you private insurance, life insurance, burial insurance, Medicare plans, Medicare, supplements, Advantage, and all that kind of good stuff. Because government insurance in and of itself just doesn't do it. I can give you a million examples from when I helped people in those critical times. So they're arguing that one of the biggest problems was this 8.7% Social Security beneficiaries got in January 2023, and the 3.2%. So they're taking a lot of blame. They're blaming the 8% cost of living increase last year, and they said stuff like that that's I've talked to a whole bunch of people when that happened and since, and they were all very happy that they received over 8%. They wish it was in terms of calculating how COLA percentage is calculated. A lot of people, kind of myself included, think it's kind of calculated incorrectly for seniors, and every year it should be a couple of percent more, if you ask me. But that's just my 2%. But they're arguing here that that's too much, and that we should gauge the COLA. We should adjust the COLA based on another index, and that will reduce the outlays going forward. So you will get less COLA going forward, And I saw another YouTube channel, which the guy I kind of respect for the most part, but I just completely disagree with him here. His argument was only the government can tell you that cutting back on benefits is the same as reducing the growth rate. And I disagree with that because this guy deals with millionaires. So if you tell this millionaire that, okay, I can give you this investment at 5% or 10%, and I can give you this other investment at 7%, it's no problem because it's only 7. Sure, you're going to have a slower growth rate, but I'm almost sure the millionaire is going to say, that's a cut. I'm losing 3% there. So it seems like it's okay for millionaires, but not for everybody else. So anyway, a little bit blurry. Yeah, I think I did a bad cut on it. Sorry about that, but yeah, I'll post it in the entire report in the remarks there. Maybe if I maximize it, and so you don't see my face, which is always a good thing. All right, let's see. So Social Security's original purpose was to provide stability for those living past their working years through additional income support. Let's see. So this is one of the reasons people always complain about, hey, it's my money. How come I can't work, and collect benefits at 63 or 64 years old without being penalized and stuff like that? Well, that's kind of, the Social Security was supposed to replace a percentage of your income that, because you stopped working. And if you don't stop working, then it kind of, that kind of defeats the whole kind of purpose of it. So that's where that thing comes in. So anyway. All right, let's see what else here. So the coming debate over how to prevent insolvency. So insolvency, that's kind of I don't know if that's a great word, because again, it's just the the trust fund that was planned for baby boomers. It's running out, but so are I hate to say it, but so are baby boomers. We're all going to shuffle off this mortal coil. So there's 3 things that could be done: is to just put more money from general taxes into the fund, which I don't think that many people necessarily agree with. Tax increases, or program savings. So sounds fine. So tax hikes. So the other option, that's not an other option. That's an option that they just talked about. But anyway, often proposed by those on the left is to raise payroll taxes that flow to the old age survivors insurance trust fund. For example, Democrats have proposed raising the cap on the level of income subject to payroll taxes. So right now it's $168,600. So everything after that, people don't pay into. They pay FICA, but they only pay the Medicare part of FICA. So if you're receiving $1 million a month, you're paying, the 1.45% on all of that. But for Social Security, you only have to pay up to $168,000. And some say that that's kind of not fair. That that's a tax on the little guy. And so they say we should apply the payroll tax to all earnings. But even Biden said he, in his proposal, he said I guess it's kind of a donut hole, that he said, okay, up to 168,600, you'll have to pay the Social Security, payroll tax. And then from there to 400,000, you wouldn't. And then from 400,000 over, you would again. And they're saying this would be the biggest tax hike. But everybody else, everybody I know has to pay, all of it, because they don't make over 168,000. So would it be a tax hike, or would it be finally, bringing a little bit of sanity, a little bit of equity to the system? I don't know. But anyway, so there's 8 pages of that, and a lot of it is, unfortunately, kind of the nature of political discourse in this country. whatever happened to the old Lincoln Douglas debates and during the Civil War, civil all day debates of substance. But anyway, that all ends, and now it's just talking heads yelling at each other. I think we're in the Roman Empire gladiators, and we just put a couple of gladiators, one from the left, one to the right, and they just go out there and attack each other, and nothing really. But it's entertaining, right? To some, yeah, it's not entertaining to me. But anyway, so all those pages and their kind of solutions are to slow down growth, so that means less money in the pocket for seniors going forward. And they say rightly so. Most on the left and the right say, okay, we're not going to do anything right now in terms of, so if you're currently receiving benefits, I get comments all the time. What's going to happen? I'm currently receiving benefits, or I'm 62, I'm 60, I'm about to get benefits. Both sides of the aisle, Republican, Democrat, all of them. I've never seen anybody said, "Oh yeah, we're going to cut your benefits right now." Even if you're receiving them or if you're in close. Nobody has really said that because that would be a political, self-flagellation, I guess. All right, so reducing COLA going forward, which again would essentially be a cut for benefits for those who most need it. So this is their final one paragraph to reduce the PIA, modest changes to the PIA. The PIA is the benefit amount you would receive at your full retirement age. That's how your benefits are decided. That's the primary insurance amount. And also make modest adjustments to the retirement age. This is the one that's getting everybody, all the news, stations and everybody are picking up on this one. Modest adjustments to the retirement age. So basically, how modest? They don't really say. That's one sentence, and they don't. Yeah, these proposals, yeah, they're just not. They spend more time attacking the other side of the aisle than giving constructive criticism. It's depressing, but anyway, so modest. So we're talking from 67, because they already did that in the 1980s, over many decades, so many years. They went from 65, your full retirement age, now it's 67. And so they are arguing to raise it to 68, to 69, to 70. They don't really say, but again, if you're, as I've said many times in my other videos, if like my father was a long distance truck driver, my mother was a waitress in a breakfast diner. People like that, just 65, 67, that just taps out. That's your body can't do it anymore. If you're lucky, and have a good desk job, like maybe some congressional people, then you might be able to, and you don't really need the money anyway. I've taken thousands of, hundreds of thousands of retirement claims, survivor claims, disability claims. And the millionaires that have received Social Security, or it's usually their secretaries or something that do it because they can't take time. These rich people can't take time out of their busy day to go down to Social Security and spend an hour doing. So they really don't care. I had this one guy, he owned a few thousand apartments throughout California, and he was like, "Oh yeah, I was just driving by, I figured I'd come get my money, and I'm just going to give it to like the church or something like that." So he didn't care. It was only a few $1,000s. That was, he probably lost $3,000, just being in the office for an hour. So they don't really care about Social Security. So anyway, they don't depend on it. And this is kind of surprising that for high income earners, the wealthiest, they're talking about cutting, phasing out auxiliary benefits for high income earners. So this is interesting. So auxiliary benefits are like spouse benefits, children benefits. So if you're a millionaire and you're 65 and you have a child that's 14 years old, then that child possibly wouldn't get benefits because you're a high income wage earner. So it would be means tested. So this would be the first time since 1935, since the beginning, that Social Security benefits would be means tested. That means that if Social Security, before they give you your money, they will ask you, I guess, do you need it? Are you making $1 million? Okay, then you're not going to get these benefits. Are you making $10,000 a year? Okay, here's your benefits. So that's interesting. And then the underlying thing, the budget does not cut or delay retirement benefits for any senior in or near retirement. So yeah, that's a pretty standard course for both sides. And then additionally, the RSC budget would promote trust fund solvency by increasing payroll tax revenues through pro-growth tax reform. Pro-growth, so this is the mantra of conservative Republicans is the rising tide rises all the ships. That we're just going to focus on the economy. More people will make money, and therefore more people will pay into payroll taxes, Social Security, and therefore it'll be automatically all fine. But if you look at there's a big thick book called Capital in the 21st Century. And if you see since the 1970s, one of the problems with Social Security is since the 1970s, a lot of the money in the economy has gone up, to the top 10, top 1%. And that's money that used to be, in the hands of waitresses and truck drivers, and they would pay Social Security tax, and then Social Security would get money from it. But now that money is going outside of the purview of Social Security. And so that's why, there's so much money that is not available to be put into the Social Security, because it's going to, the Musks and the Amazons and, the guy with, thousands of apartments throughout California. And so that's one of the problems, is that the money is just going up and it's not being, put into the Social Security system. So there's that. All right. So let's see what kind of questions we have. Greg has a question about a CDR. So let's see. We'll talk about that in here a little bit. Let's see. Put them up here. Let's see. Hello. I just recently found you on YouTube. Welcome. Thank you. Make sure you share it with everybody else so they find us. But so far, I'm feeling confident that you will help get my questions answered. Thank you so much for your service. You're welcome. Let's see here. Naomi Saunders. I heard that Social Security was gone in 2035. Now, that's I talked about this in another video. There's also a lot of scare tactics out there, because in my personal opinion, one of the long-term plans, because the Wall Street, investing class, they want their hands on the, trillions of dollars Social Security trust fund and, payroll taxes. They want to be able to use that money to, yes, invest, but a lot of the investment is actually, speculation. And so they've wanted Social Security money for decades and decades and decades. But they just can't go out there and, take it outright. They have to convince people to give it to them voluntarily. I think there's a few movies like that about, we can't force you. You have to. I think it was a Marvel, that's one of the themes of the Marvel movies. It's like, you have to give up your liberty voluntarily. So you have to give up Social Security voluntarily. How do you do that? Well, you convince people that it's not going to be there anyway. It's gone. So who cares? You might as well just go ahead and give it to us, and we'll do a lot better. And so no, it's not going to be gone in 2035. The trust fund will essentially be depleted in some respects, not the disability trust fund, but the retirement trust fund will slowly be depleted. But again, that money was kind of, saved up for the baby boomers. I think it should have definitely lasted longer. But what are you going to do? Another, let's see here. Glad I found your channel. All right, Clover Soup. Welcome, welcome, welcome. All right, here's one. Any cut made to any Social Security benefits should have an equal and automatic cut to the salary of the president, staff, Senate members, House members directly. I like it. Yeah. It's like, yeah, they've, I'm sure their COLA increase, they don't blame their COLA increase for, the budget when, the shortfalls. Yeah. So maybe double. So if they cut, if last year instead of 8%, they said, okay, we're going to do 6%, maybe times 10. Okay, you're going to cut back everybody that's dependent on Social Security by 2%. So we'll cut back congressional pay by 10 times that. So we'll cut you back 20%. Are you all good with that? Right? That's all right. I like that idea. Let's see here. How is it Biden did nothing bad? He is not the one that hired that Andrew Saul. Yeah. All right. Let's see here. So if they are talking about cutting Social Security, where are they trying to put our money we paid into the fund? Yeah. So the money in the fund is still there. It's obviously in Treasury bonds. So, people always say, oh, the government's in debt. And yeah, if the government can't pay Treasury bonds, if they can't pay that, then we have a lot worse. We're on the verge of the zombie apocalypse. So if that's because if you ask an investor what's one of the safest investments out there, they'll say, oh, United States Treasury bonds. If you ask other countries, where do they in the world financial market, where is the safest investment? Is it Chinese Treasury bonds? Is it Russian Treasury bonds? Is it Brazilian Treasury bonds? No, they all put it in American Treasury bonds because they all know it's safe. So that's kind of that, budget, and it's earmarked for Social Security. All right, let's see here. Cayenne Trails. Oh, okay, all kinds of good flamingos and all the rest of it. All right. Let's see here. Is there any area on your site that explains or discusses IRMA? Yeah. I talk about that in the Medicare one. So basically what it is IRMA is a higher premium, Part B premium for those high income wage earners. So if you're, making, $300,000 a year, then your Part B premium is going to be more than, the $170 and change. But you can, if you get divorced and your income was that, but it's because you were married and you get divorced, you can get it reconsidered. If you stop working, you can get it reconsidered. So yeah, I talk about that. I don't know if I have a separate video on it. Yeah, that's another one of the 400 videos I have to make a separate video on. All right. Let's see here. Democrats always know how to spend your money better than you do. Well, I think that goes across the board. Republicans, Democrats, liberals, conservatives, Whig Party, whatever the case may be, all politicians think they know better than we do. So, yeah, I mean, you just look back on history. All right. So that was everybody. Please press like. Got another one here. If Bush put back the billions he took from Social Security, then again, Social Security, there was no money taken out of it. Social Security, just can't, put it under the mattress or, Al Gore's lockbox. What does that mean, lockbox? They put in a box and, an old chock full of nuts coffee can and, put it in the backyard. And, you want at least to get, keep it up for inflation, 2 or 3% or something like that. So that's why they do kind of, I'll have to do a one on the trust fund. But again, the trust fund was, kind of this separate trust fund that we have right now was specifically set up to cover kind of the baby boomers and to have kind of because they look at the demographics and they saw baby boomers we're gonna need more money, and unless people have a whole bunch of kids, then and they have good jobs and they're able to pay, then there's going to be a shortfall. So a trust fund was set up, and now the trust fund is using specifically kind of what it was intended for, is for the baby boomers. So that'll slowly, again, if the demographics look, and we'll need to set up another trust fund for maybe another baby boomers, or if we want to add benefits or whatever the case may be. So, Sweet Bug, hey, what's up? Thank you for great information. You're welcome. Yeah, I'm trying not to be too political. If I'll be fair when the Democrats come up with a plan, because none of this is rocket science. I've been behind the scenes at Social Security for a few decades, and people say, well, if you raise taxes, that's going to solve everything. Well, come on, there is no silver bullet. You have to do a multitude of things. Means tested for millionaires. Because like I said, I've talked to many of these, and they don't care about the extra $3,000. That's they make more of that an hour. I think that's Shohei Ohtani's lawyer. I think he gets I was reading what he gets $1,500 an hour, or $2,000 an hour, something like that. The Los Angeles Dodgers guy. Yeah, so they don't care. So means tested. Okay, I could see that. That'd be one solution. It's a whole bucket of solutions. I don't believe raising the retirement age is a good one. But yeah, so I definitely agree that everybody should pay the equal amount percentage in terms of payroll taxes. If I and I think 99.9% of people out there that are watching, you pay everything, all your earnings, you pay, part of that into payroll taxes, into Social Security, FICA. If there's 1% of those making, over 168,000 or so, then buy me a beer. All right, let's see. Okay, all right, let's do question and answers. Is there anybody on here? So the big thing the last few days was the change of overpayments yesterday. So there is that new policy on overpayments, and I gave everybody a plan of attack to get their overpayments kind of renegotiated to make their lives easier. I wonder if anybody out there has done it, and let me know. So how's it going? You probably couldn't get in on the phone lines, and I'm sure the offices were just inundated with people throughout the country trying to get their, take advantage of the that new policy. So, all right, let's see here. Question, Greg. Hey, Greg. I received a SSA 820, filled it out best I could. I sent it out on February 14th. I've been on SSDI for 2 years. Should I have heard anything yet? No. So the 820s, basically, yeah, they're probably going to be doing a CDR. Not sure whether they're doing a work or sometimes they send out both, and there's a whole package that they send out. Yeah, so they're evaluating, I guess, on a regular basis. You might have a 2-year review for your SSDI, your Social Security Disability Insurance. So basically, I talk about this. Make sure you watch my videos on CDRs, but it's a budget-driven process, in the sense that, each office, your particular office, your district office, might have, okay, you've got to do 100 a month. So again, as I talked about, they send out 200 of these packages, the 820 and everything else. And because people move and they don't return them, but that office has to do 100 a month. That's their quota. They have to do 100 a month. And if they don't, they get, it was a nightmare trying to get that done. If you go over, it's bad. If you go under, it's bad. I spent more time trying to make sure I was, if it was 100, I had to be at exactly 100 for our particular office. Yeah, it was crazy. But anyway, so they would send out 200 to make sure they get 100 good ones back, so they could continue to process the continuing disability review. So yeah, if you haven't heard anything, then I wouldn't worry about it. It's either because they already filled their quota and they had 101, and so you're good. But then again, they might hold yours for next month, but they can't hold them very long because after 1 or 2 or 3 months, then stuff changes. So they need something current. So super long story short, don't sweat it, don't stress. Whenever that happens, you get a form from the Social Security like that. Fill it out the best as you possibly can. Make sure you fill out every block. If it doesn't apply to you, just put non-applicable NA. Make a copy of it, return it, and then go on with your life. Please go on with your life. Let the bureaucracy do what the bureaucracy will do. So please don't sweat it. Make yourself, you'll drive yourself crazy worrying it. See what happens when you worry about bureaucracy? I used to have a full head of hair. No, I never had a full head of hair. But anyway, let's see here. Follow-up question. I received a letter from Social Security in the middle of March of my correct overpayment. Does this mean the H-20 investigation, whatever call is over? Yeah. That's I really couldn't answer your question without looking at the file, and obviously I'm no longer employed with the Social Security Administration. I am retired. So whatever, call them up and ask them. Says, okay, what does this particular letter mean? Is it correct? Whatever. Let's see here. I'm looking for other Social Security / Medicare type questions. Okay, here's one on our discussion today. I believe anyone making over 400,000 should be paying their fair share, with their fair share being 6.2% of the annual pay, same as what all other employees pay into. Yeah, I personally agree with that too. There was a famous thing as Warren Buffett, the sage of Omaha, one of the richest guys in the world. Many years ago, he was. They were interviewing 60 Minutes or something like that, and then they were walking around his office. He's a very down to earth guy. Lived in the same house, drives the same car, eats at Omaha Steaks and whatever. He went to a secretary, and the secretary, she was making pretty good money, but he asked her, says, how much do you pay in taxes? And she said, 20, 30, 35%, whatever the case may be. And he's like, I pay like 1. So she pays more as a percentage, than he does, because again, they don't get a salary. They capital gains and all this kind of stuff, and capital gain. Yeah, that's another thing. Income. That's easy for the rich to, because most rich don't make an income. They capital gains and investments, and so they don't make it a W-2 income type thing. So was it the golden rule? Those with the golden rule. And people always say, that's the law. They're just following the law. Well, who makes the law? It's so it's the rich and the rich politicians that need the funding to run for election. They make the laws to favor a particular class, and then the particular class just says, I would be stupid to do otherwise, because that's law. So of course I'm not going to pay more taxes than I have to. That's the law. And who made that law again? Anyway, so all right. It should go back to 65. This is still the best country in the world. No reason it can't be fixed. I agree. I'm an old Marine Corps sergeant, so of course I'm going to be very patriotic. But I also, one of my jobs is to poke my politicians with a sharp stick to make sure they do the right thing for the future, my family and your family, and take care of people, because I read the comments y'all send every day, and man, there's just a lot of people. That's why a lot of people, struggling. That's why I did that series of videos on how to live on Social Security alone, which is very impossible. but I did a series of 4 videos. So make sure you check out those 4 videos. And I apologize for the super long, boring introduction. You just skip through the first 8 minutes, unless you want me. I think it's important, the first 8 minutes. I should have talked a little faster, but anyway, there's that. I'm new to the whole YouTube thing, as you can tell. Let's see here. I'm waiting to get my full retirement age at 66 in 10 months, January 2026. I just turned 65 yesterday. Hey, March 20. Hey, happy birthday. All right. Happy birthday. Everybody say happy birthday to Cayenne Nature Trails. All right. So I don't know if you already signed up for Medicare. If you currently have health insurance from work, you don't have to sign up for Medicare. But if you don't, you had to sign up for Medicare. And if you're looking to something to cover the gaps, as I say, my recommendations is, let's see here, let me take this off, is, Medicare plans, Marketplace, if you're not even close to Medicare, vision, dental. I have partners that I put together. So I recommend looking into all these with someone that you know and trust. If you don't, give me a call, email me, and we can put you in touch with someone. And then people always say, hey, what do you talk about insurance? It's government. You ever heard of FICA, Federal Insurance Contributions Act, the Old Age Survivors and Disability Insurance, Medicare health insurance? It's all insurance. So, but government insurance alone just doesn't cover it. So that's why I've put together partners throughout the country that can help you with all that. So give us a call. So, all right, let's see what else we got here. Yeah, most people don't know that self-employed pay double. Yes. So because if you work for someone and you pay 6.2%, then your employer pays 6.2% as well, then 1.45 for Medicare. But if you're self-employed, then yeah, you pay both. Yep. Yeah. So that's a hit. Definitely is. That's a tough one. But as I mentioned in a few of my videos, that's one of the regrets. People that are self-employed, they hate, having to pay, the 12% plus for all that. So they try anything they possibly can to not pay it, to take a bunch of deductions and move money from here to there and do all this kind of stuff and set up, the LLCs, and so they can avoid paying their Social Security. And I can tell you, this is my personal experience after helping hundreds of thousands of people with retirement, is 99% of them, when they come into Social Security 10, 20, 30, 40, 50 years later, and I tell them how much their benefit amount is going to be, they are, oh my gosh, what am I going to do? I can't live on that. It's because you were making good money, but you just moved around so you didn't have to pay it. And, most, if they invested it well and everything like that, but most is like, oh yeah, I bought a car and then, it got old and I spent crazy amount of money doing this and vacations. And now in my retirement, I have to live on $800 a month. Yeah. So that's just, take that with, whatever grain of salt you like. Yes, just got a Medicare Part A, working at a private college on the Employee Health Aetna Gold Plan. Oh, okay, perfect. All right, working at a private college. Okay. I also teach at a university as well. 3 classes this semester. All right, Part B. I think I apply when I stop work. Yes. So if you currently have health insurance from current work, that's the important thing, and your employer has 20 or more employees, then yep, you don't have to sign up for Part B. When you stop working and stop receiving health insurance from that current work, then you have 8 months, technically, legally 8 months to sign up for Part B and avoid the penalty. But what happens when you don't have health insurance for 8 months? That's when you actually have an accident or get sick. So I recommend a couple, 3 months before, your health insurance is going to stop, sign up for B, and then find a plan to cover all the gaps, and that way one health insurance stops on the 31st, and the next one starts on the 1st. That's yes. Yes. Is Part B the one, or Medicare the one you have to do at 64? Yeah, the Part B one. Yeah, Part A is the hospital insurance, and that's free for most people if if you worked and paid in for 10 years. But yeah, Part B is the one that this year is what 176.40, 170 some change. Next year to go up. But yeah, if you don't get it when you're supposed to, then you'll have to pay a penalty of 10% for the rest of your life. Part D as well, the Part D prescription drug plan, same thing. If you don't get it when you're supposed to, you have to pay a penalty for the rest of your life. And for the Part B, that's the big one. It's 10%. So if the Part B is $200 that year and 10%, so you have to pay $20 extra. So you have to pay $220. Or if you 2 years late, $240, and that's forever, and ever. I don't have Part B, but I get the same insurance that I had when I worked for the post office. Yeah, I think the post office just changed their law this year, so I would definitely reach out. And but I think they're making people sign up for Medicare. So I think that started this year. Yeah. Let's see here. Question: how analyze income requirement of 66 and 8 months and say this year is 20? The birthday is in the middle of the year. Thanks. Yeah. So basically, the first year you retire, Social Security can go to a monthly test. So okay, let's see. What did you say? Let's say July, middle of the year, July birthday. So you start your benefits in July, and let's say you're 62. Okay, how in 66 and 8 months, and say there's okay, so you're full retirement. Okay, let's do it both ways. Let's say you're 63 and you stop working in June. So you start your Social Security benefits in July. So from January to June, it doesn't matter. You can make $1 billion, doesn't matter. Starting July, you have to stay under the monthly limit, which is $1,860 this year. Next year, you have to stay under the total yearly limit. You can't switch to a monthly. The monthly is only the first year. Okay. All right. So once you hit your full retirement age, let's say your full retirement age, 66 and 8 months, is in July. From January till June this year, you can make $59,260. I think it is about $59,000. Starting your full retirement age, you can make $1 billion for the rest of your life, and it doesn't matter anymore. Okay. So there's that. What does Part A actually pay? Let's see here. Let me see. Let's see here. So I think I have. Going through the? Hold on one second. Let me see if I have. I might not have. But Part A pays for a hospital. Yeah. So if you have surgery and they put you in the hospital for 2 days for your surgery, covering all that kind of stuff, Part A pays for the hospital part of it. Part B pays for the actual surgery. So yeah. So in Part B is the one that can really hurt you, because if your surgery, so what the actual surgeon and anesthesiologist and everybody charges is $100,000 for whatever surgery, you have to pay 20% of that cash now, and that's unlimited. There is no cap. So that's why people get either a Medicare supplement plan, also called a Medigap plan, or a Medicare Advantage plan. And again, if you want help finding one in your particular area, call my team, and they can see what's available in your area. Like I said, I put together a network of partners throughout the country that helps with all this, because I know from personal experience, Social Security, Medicare alone ain't enough. Let's see here. Can you have Part A without Part B. Absolutely. I think Cayenne, he or she, yes, has Part A. Just signed up for Part A because they have health insurance through work, and A doesn't cost anything. Again, if you're insured, if you worked at least 10 years, so doesn't hurt to have a little bit extra coverage. But one thing is on Part A, if you have a health savings account that you're contributing to and you sign up for A, you can no longer contribute to that health savings account. You can take money out of it, but you can't contribute. So, but if you don't have a health savings account, you're good. Go ahead and, sign up for Part A. It's easy. And then once you actually stop working, then you sign up for Part B. A lot of people do that. They get A at 65, and then a year, 2 years, 3 years later, they sign up for B because they stopped receiving health insurance for current work. I always have to make sure I say current work. It's not, COBRA. It's not a retirement health insurance. It actually has to be from current work. Everybody, please press the like button. Let's see what else we got here. Can I pay Social Security tax, self-employment after fraud to boost your pension? Absolutely. Yeah. A lot of people wonder about that. Is even after you start collecting your benefits, your benefit amount can increase, obviously, from a COLA. But if your yearly earnings, whether it was W-2 wages or net income from your self-employment, and you pay taxes on it, and that's one of your high 35 years. So, again, Social Security determines your benefit amount by your high 35 years of earnings for your retirement, survivors, auxiliary, and all that. So if it's one of your high 35 years, you submit your taxes to the IRS, you pay whatever net income, you pay FICA tax based on that. And then the IRS notifies Social Security and says, hey, Max just paid X amount. And Social Security looks at all your other earnings and they say, oh, that's one of Max's high 35. And here's the lowest one. So we'll kick that one out and we'll stick the new high one in there. And then we'll recalculate. And this usually happens, March, April, May, June, whenever you file taxes. And then let's say it happens in, April, and then Social Security kicks out the low one, puts in another one, recalculates, oh, Max is due another, $20 a month. They will do it starting in January because you were entitled to that starting in January. So if it starts in April, then you get $24.68, $80, and then back pay, and then $20 for the rest of your life. So it's a beautiful thing. Let's see here. VT, I have Part A and no Part B for my Social Security disability. No amount due to. Yeah, a lot of people don't know. I run into people all the time that they don't realize that you're 55 years old and you get approved for disability benefits, and they don't realize that within 2 years, the 25th month, they will receive Medicare. So when you're on disability for 24 months, that 25th month, you will receive Medicare automatically. They'll send you your Medicare card in the mail and everything like that. And if you have, again, health insurance from work, then you just, refuse it, A or B or both, whatever you want to do. I've talked to and again, this is why I need your help, is getting the information out there, because I have run into a lot of people that they have disability. They've been on disability for 3 or 4 years, and they haven't gone to the doctor. And I'm saying, they tell me, oh, they've got this terrible condition, but I can't afford to go to the doctor. And says, well, Medicare should pay that. Oh, I don't have Medicare. I'm not 65 yet. No, you do have Medicare. They've moved, or they just didn't get the mail, or people get so much junk mail, they just probably threw their Medicare card away, and they didn't realize they actually had Medicare. So for that 2-year period, they could have actually been going to the doctor and getting themselves better, but they didn't know they had it. And yeah, that's unfortunate. So that's why we need to get the word out there. So anything y'all can do to help get the word out there is immensely, immensely appreciated. All right. What exactly is Medicaid? Okay, Medicaid, before I worked for the Social Security Administration, I actually worked for the Department of Social Services doing Medicaid and food stamps and all that kind of good stuff. So Medicaid is a federal state program health insurance, but it's a means-tested income-based health insurance plan. So it's administered by the states. And what a lot of people don't know is you can have Medicare and Medicaid. Millions and millions of people have Medicare and Medicaid. And if you're, having a hard time paying for your Part B premium, please, please, please call your social services, Department of Welfare, whatever the case may be in your particular state, and apply for Medicaid. And if they approve you, depends what level they approve you at, they might pay for your Part B premium. So that'll put an extra $170 plus in your pocket, which is always a beautiful thing. And if you have Medicaid and Medicare, again, it depends what level of Medicaid the state gives you. It depends on your income and resources, everything. You might get a lot more benefits. And if that's the case, then, you can also look for a Medicare Advantage dual eligible plan. And again, call my team, and they will see what's available in your particular area. 888-817-0446 and see what's available and see if you're eligible for a dual eligible plan, Medicare, Medicaid. Let's see. All right, let's see here. So I'm 53, and this year I'll be hitting 2 years on disability. I just lost my Medicaid, so I will have the opportunity for Medicare. Absolutely, you will not only have an opportunity, you will get it automatically. Medicare will send you your package in the mail, so make sure Social Security has your right address. Because when you update your address with Social Security, it automatically goes to Medicare. So Medicare gets the information as well. And, about 100 days before, your 25th month, Medicare will send you the package automatically. And then it's a beautiful thing. And then, like I said, give my team a call at that number. And, tell them you want to kick around, see what's available in your area, and it's a free service to you. And my partners supports our channel here, so it's a win-win-win. You get health coverage, and we're able to keep doing what we're doing today. Let's see here. They sent me to the marketplace, and there's no way I can afford insurance. Yeah, so the marketplace, ACA, Obamacare, so that's the 2-year period before your Medicare starts. On those, there are premium subsidies. So it depends on your income and resources, but part of the marketplace, they will pay for your premium tax, advanced tax subsidies, and some cost sharing. So you should be able to get some help there. But if you're going to be getting Medicare soon, and a lot of people like this. So if you, if you're close to getting Medicare, whether you're on disability or whether you're about to turn 65, and you're on a marketplace health insurance plan, you can technically keep that marketplace health insurance plan. However, you're going to lose all of your tax premium subsidies and cost sharing, everything like that, because you have Medicare. So switch from the marketplace to Medicare. That's what I would recommend. Let's see. Kim, so I am working and plan to retire at the end of 2025, beginning 2026. So I don't need to apply for Medicare until I retire. That is correct. Yep. Again, if you currently have health insurance from work, then and you like it, and it doesn't cost you an arm and a leg, and your employer has 20 or more employees, and yeah, then yep, you're good. Make sure I include all the qualifications there. So yeah, if you turn 65 today, you don't have to sign up for Medicare Part B. I would recommend you don't. Save yourself the $170 or so, and buy me a beer or coffee, because did we save you money? If you did, yeah. But if not, but anyway, yeah. And then when you do stop working, like I said, 3 months before, then signed up for Part B, and you'll need a couple of forms. I have a video on this. It's the 40B and the 564. It's just basically, one is to sign up. I want to sign up starting this date, and the other one is lost my train of thought. The other one is that you have to take to your employer, and your employer says, don't penalize Kim. She did have health insurance since she turned 65, and they'll put down there, you've had health insurance since this time, and it just stopped. It'll stop next month, and then there'll be no penalty whatsoever. So you'll be good. What is the difference between G supplement and the N plan? Okay, so yeah, I did a couple of videos on this, but those are the ones that most people today, 99.9% people sign up for. There was an old F plan, but newer people can't sign up for that one. The G and the N are almost, they both don't cover the Part A, the yearly deductible, which is like $240 this year. And then G covers everything else that, Part B and everything Part A doesn't cover. Covers the 20% and hospitals and everything. Plan N doesn't cover that yearly deductible, the $240. And two more things it doesn't cover. It doesn't cover what's called excess charges. Excess charges are some doctors, there's only a few percent in the country, that don't take the Medicare price. They don't accept Medicare rates. So they can charge up to 15% more. But most doctors in some states, they don't even allow that. So, and then also, and you might pay when you go to a doctor for like an initial diagnosis, you might pay, I think it's up to $20. Usually it's about 14 or so. If you go to the hospital or emergency room, it could be up to $50. Unless you're admitted to the hospital, then it's not anything. So, and a little bit more costs there, but usually N, the prices are lower. The premium is lower per month. So if you watch my videos on this, I did a video on the difference between G and N. Personally, because I'm cheap, I don't like giving away money. I don't have to. I think N is the better deal. And then super close under that is a G. So you can go either way, you flip a coin, but I kind of like N. That'll put me in, coffee for, that'll pay my coffee budget on a monthly basis by doing N versus G. So, and that's a lot of money. I drink too much coffee, but anyway, so there's that. Fantastic. I'm grateful to have found you. We'll look you up. Oh, okay. Thanks. Glad you found us too. Kim Jones. Thank you. You're welcome. Glad I was able to help. All right. We are at an hour, and I think that's enough of y'all looking at me. People are looking to handle an hour of me, a lifetime. So I think I shall end it here. All right. And on Thursday, we're going to talk about, the topic will be what happens when you die. Very interesting. But anyway, it'll be exciting. So I will see you Thursday. And then as always, I'm going to continue try to doing a Q&A after. And please share. Yes, please share, like, subscribe, all that kind of good stuff. And y'all have yourself an awesome day. And we'll talk to you soon. Bye-bye.